Last part. So interfacing. So what does our renal system interact with? So there's minimal interaction with the musculoskeletal system. Our kidneys are protected a little bit by our lower rib cage, but most of it is through interaction with calcium metabolism and production of vitamin D by the kidneys. That's the big part. And a lot of that's actually done through the endocrine system. Um, there's nominal interaction with our skin. Again, that's because we have to uh, produce vitamin D. Um, there's a lot of interaction with the cardiovascular system because our kidneys are dependent on blood flow and blood pressure. Um, and our kidneys then regulate how much sodium works their way back into the bloodstream, and water follows sodium, and that has a direct effect on blood pressure. So if your blood pressure is too low, your kidneys are going to try to respond to that by holding on to fluid. And if your blood pressure is too high, your kidneys are going to make some very bad adjustments in response to that. So your kidneys have a whole lot of interfacing with the cardiovascular system. They also make erythropoietin, EPO, which is a hormone that signals your bone marrow to make red blood cells. So cardiovascular system and the renal system are really interlinked. There's minimal interaction with the pulmonary respiratory system, although your kidneys do have a relationship with bicarbonate metabolism, and because your lungs blow off and retain carbon dioxide, there is a little bit of a link there. There's a very minimal interaction with the immune system. Frequent urination does prevent bladder infections, and if your kidneys do get damaged, you can pee out antibodies because you're letting proteins through in your urine. Very little interaction with your neurological system. There's almost no interaction with your GI system, though your kidneys and your liver both are involved in filtering your blood, just in different ways. There's not a whole lot of interfacing with your reproductive system. It's just use of similar structures, but that's more in males as opposed to females. Lots of overlap with the endocrine system. Your endocrine system will tell your kidneys to hold on to sodium and potassium, or hold on to water, or let certain ions through, depending on what their concentration is in your bloodstream. And again, also vitamin D metabolism. So cardiovascular, renal, endocrine system is a real triad here. And then again, same thing with vitamin D. So what can go wrong? So think about all these what if questions. What if your renal artery doesn't let your kidneys see blood anymore because they're blocked? What if you have trauma and bleed severely? How are your kidneys going to respond to that? What if your glomerulus and your filtering ability of the nephron is damaged? What if the whole loop of the nephron, of the proximal convoluted tubule, loop of Henle, distal convoluted tubule, it doesn't function? And there are certain genetic disorders that do that. What if the hormone cascade that's supposed to regulate ion retention or water retention or water excretion gets messed up? That happens. What if a ureter gets blocked? What if a ureter allows urine to go back up it when your bladder squeezes when you go to the bathroom? That happens. What if your bladder gets damaged because of trauma? What if you get bladder cancer? What if the bladder gets infected? What if you get a kidney infection? And which is worse, a bladder infection and kidney infection, and why? What happens if you get urethral damage in a trauma? What if your urethra gets blocked? So all of these what ifs are scenarios that actually happen. So we'll go through some diseases like we usually do, and we'll use the abnormal to illuminate the normal. But more than any other unit, focus on blood flow to the kidney, filtering at the nephron, going through that whole glomerulus tubule loop, make the urine and get it out of you. So big picture, guys, let's get to work and talk about some interesting diseases.